Every year, up to 80% of runners get injured, but what do you do when you have pain? Can you run through it? So we're going to talk about that today. My name is Dr. Mark Murdoch. I'm a chiropractor and owner here at Basecamp Chiropractic and Sports Rehab. I'm an avid trail runner, and we're going to talk about when to call it quits or when to run it out. So there's three big decisions or three big guides we can use to basically guide our decision making when it comes to training and running through injuries. So that's the pain intensity itself, where you're feeling the pain, and then your response to pain. Who is this guy? My name is Mark Murdoch. I'm a chiropractor. I have my master's degree in sports medicine. I'm here at Basecamp Chiropractic and Sports Rehab in Vernon, British Columbia, and we work with a ton of runners. It's a super active trail running community, road running community, and about 80% of our practice at any given time are runners. And then, of course, I'm a trail runner myself. I love being outside. I love being on the trails. We're super lucky to have so much good access here. So the first kind of thing we need to think about is just the pain intensity itself. This may seem obvious, but a 1 out of 10 pain may not take me off the trail. It may not always have to. So pain intensity is important. It's not going to be the only thing that guides our pain, but it's definitely something we need to consider. So my rule is if it goes up more than 3 points on a 10-point scale from whatever your baseline is walking around, you're probably going to want to call it quits. So if I'm at a 2 out of 10 pain, I go and I start running, and that pain goes up to 5 out of 10, it's worth stopping running. The other thing associated with that is it's much more likely as that pain increases to cause me to limp. If I'm changing my gait, if I'm changing my foot strike, I'm going to want to call it quits. I'm going to want to get that assessed and then get cleared to run by someone who knows what they're talking about. So either a sports chiropractor, sports physio, some sort of sports physician that knows a thing or two about running, so they can give you increased confidence that you're not going to make this injury worse. Now, pain is a subjective experience. Everyone experiences pain a little bit differently. So a 5 for you may be a 7 for the next person. It may be a 3 for the next person. So keep that in mind. But if you have an increase in pain while you're running, you probably want to back off, especially if it's getting to 1 to 3 points out of 10. In general, a pretty good threshold for pain intensity is 5 out of 10. If it's more than 5 out of 10 on a 10-point scale, you probably want to back off of your running, at least for a period of time. The other thing is pain location. So different areas are higher risk of being an immediate concern than other areas. So the first principle, though, is if this pain is new or unfamiliar to you with your running, you probably want to back off. You probably want to stop your run, see if you can do some sort of active intervention to change that. The other spot that I generally am going to discourage people from running is if you experience a new pain on the bottom of your foot, if it's starting to present like plantar fasciitis, there's a good chance if you continue to run on that, you're going to make things worse. Now, I see a lot of people with plantar fasciitis that it turns out it's not even plantar fasciitis, and we're able to resolve that relatively quickly. But if you're stubborn and you keep running on that, heal and keep stretching and straining that plantar fascia, it's going to lengthen, it's going to drag out your recovery time. The other one is when the pain is on the bone. So if you're having a pain on your shin bone or on your pelvic bone, or it feels like it's deep pain into your hip, you're probably going to want to back off. There's a higher risk of stress fracture causing more damage than a tendon or muscle pain. The fourth one is if you have pain on or in the tendon. So whether it's Achilles tendon or patellar tendon in the knee, I do have an asterisk on this one because a lot of my patients can still run with tendon-based pain, but we probably want to make some sort of modification. So if someone's coming in with Achilles pain, there's a good chance I'm going to put them in a heel lift. We're going to change our terrain selection. We may change the warm-up for running. We may change the volume or the intervals that we're doing. We can often run through tendon pain to an extent, depending on a couple other categories, but we need to be familiar with that before we just say, okay, this is just part of running. I guess I'm just going to keep running because it's a tendon pain. Not so fast. You probably want to pump the brakes a little bit. You probably want to get that assessed so we know, okay, this is a safe tendon pain to keep running through, or this is a not so safe one and we want to modify in XYZ way depending on your specific injury. And then the third thing for me is the pain response. So we really like to use the red light, yellow light, green light system to guide how much running, how intense our running, and when we're going to start pulling the plug, when we're going to quit running. So the red light and the green lights tend to be much more obvious. The yellow light is in the middle. There's a lot more nuance to it. So a red light, if your pain increases to 5 out of 10, it continues to increase as you run more. If there's any swelling, if there's redness, if you're starting to limp, and then if after activity your symptoms or your soreness in that spot persist for more than 24 hours, you're going to want to get that assessed. You're probably not going to want to run on it again the next day. Or if your activities of daily living are compromised, if your Achilles pain or your heel pain is so bad that you can't drive your car anymore and get to and from work, we're going to want to back off. That's a red light. That's just doing too much. Green light's pretty obvious. You don't have any pain during. There's no swelling, no redness, no limping, no soreness. You don't compromise your activities of daily living. You feel totally fine. Yeah, you can probably continue to run, right? There's no change in your symptoms. You can continue to use running. The yellow light is where things become a little bit more ambiguous because everyone's going to have a little bit of a different tolerance. So if my pain increases by less than a 4 out of 10, but I don't have swelling, I don't have redness, I don't have limping, and my symptoms are less than 24 hours after my activity, my ADLs are still okay, that's where we can start to push into pain a little bit. And this is where we have that conversation about tendons as well, because tendons versus muscle versus joint, we're going to approach a little bit differently. So if I have a little bit of an increase in my tendon pain, but I'm doing the steps that I need to basically rehab that tendon, I'm going to be comfortable with a little bit more pain with some caveats on that. If it's a hill sprint and you're getting some Achilles pain and tightness, that's an example where we're probably going to back off. That being said, the yellow light tends to be where most of our patients are because one, they want to continue running, and two, pain is not always the sign that you have to stop doing what you're doing. It's just a symptom. It's the check engine light coming on. It needs to be addressed, but it doesn't automatically mean that you have to stop running. So really common, patients will go to their medical doctor, they'll go to their primary care, or they'll go to physio, they'll go to chiro, and they'll say, hey, like my knee pain or flares up, my knee flares up when I start running, I'm getting this knee pain, what should I do? And they say, well, stop running, running is bad for your knees. Well, that's simply not the case. Running is actually really good for your knees if the dosage is correct, but sometimes we do need to rest. Rest tends to improve symptoms, but we want relative rest. If someone's running 100 kilometers a week, 50 kilometers a week is a 50% reduction in their overall volume. For me, 50 kilometers a week is pretty much at my peak. I don't generally run more than 50 or 60 kilometers per week. So for me to have relative rest, I'm going to have to drop down to 20 kilometers a week, 25 kilometers a week, that sort of thing. But ultimately, that's still a relative rest for my overall volume. There are some exceptions to that. If we think it's stress fracture, we're going to pull you out. Okay. There's certain conditions where relative rest is going to be absolute rest, but in most cases, you can get away with and even benefit from cutting back your running, supplementing with some sort of activity, gravel biking, mountain biking, swimming, paddling, whatever. You don't have to completely eliminate your activity. Injuries suck. There's no kind of two ways about it, but understanding your pain can set you up for success. Plus, it can keep you doing that thing that you want to do. I heard this really good quote from some friends of mine at the Movement PT, a clinic in Dundas, Ontario, and it's the fastest way to return from an injury is slowly. As soon as your pain goes away is not the day where you want to jump back into the training schedule exactly where you left it. If you want long-term results, you need to be progressive, you need to be patient, you need to be slow. And funny enough, you're going to come out better on the other end because of the rehab exercise and the progressions that you go through. It's actually going to leave you as a better runner than if you didn't get injured in the first place. So you have the opportunity to work through that. You have the opportunity to improve. Staying optimistic is huge when it comes to running. I do understand that pain sucks. I'm a runner. I hate it when pain's keeping me out from hitting the trails and especially being outside. So if you need any help with that, feel free to book a consult with me at basecampclinic.com. If I can't help you, I'll help put you in touch with someone who can so that we can get you out on the trails, crushing those PRs, back to running injury and pain-free.